Okay, so this morning I will be talking about reaching the unreachable in terms of early brain development through community partnership regarding early brain development. Can we go to the next slide, please? So early brain development thing that happens in development in every child, even the unreachable. That is what we would like to look into and how that can be done. Next slide, please. My slides need to move. Could you please? Yes. No, I need the first slide. Please, can you go back? First slide. Slide. Something wrong with the slide projection. I'm still waiting for my slides. Okay. Previous slide, please. Yes. So we know when we're talking about early childhood development, a lot of policies are there in place, lot of schemes have come in, but who is going to provide this early childhood development? It is the mother. And there remains a big gap between the mother and child in the unreachable areas and what we are doing now. Next slide. So the question remains how to bridge this gap. And why this gap? Because parents at the grassroots level are still oblivious of childcare and responsive parenting skills in many places. There is a lot of lack of awareness at all levels of healthcare delivery, as well as a lack of motivation. Again, what can we do there? Next slide. So this led to a lot of brainstorming. We've been thinking about it till an innovation came up and we took up a small project, my organization, along with UNICEF Kolkata, whereby we took up one block, one county, and over a 6-month period, a tiny pilot project was worked on, and it did show a lot of promise. That is what I'll be sharing with you today. Next slide. So what we did was we looked into regular mother-child group meetings by trained personnel who were recruited locally. So it went in 3 steps. Step 1, a 7-day intensive in-house training was provided at our institute to 8 young graduates from the locality. Step 2 was these individuals who were trained, they were called community ECD activists. They entered into the community, identified all mothers of 0 to 3-year-old children, and they conducted a baseline survey as well as motivated these mothers to join local groups. And in the third step, with these mother groups, Regular mother meetings were conducted for a period of 5 months. Let us go in a little bit into further details. Next slide. So if we look at what we exactly did, we chose, as I said, a rural block with a population of around 2 million. And there we had identified 8418 families with children 0 to 3 years of age. From this locality, we picked up 8 girls right from the community, and we provided them with a 7-day intensive training. Each girl then went back and identified mothers in their own area who had children 0 to 3 years. In this way, each girl had identified 100 to 120, bringing us a cohort of around 1,000 mothers. And in this program, each of these 1,000 mothers got a next slide. Yes. So let us take a quick virtual journey through the exercises, what had actually been done. Next. So first of all, coming to the training, it was a 7-day intensive in-house training provided by a team of development pediatricians and therapy providers. And the focus was on early childhood development, nurturing care, early stimulation, parenting skills. And through this, these girls were now trained as community ECD activists. Next slide will show you pictures, more pictures of what was really done. There were, as you can see, didactic lectures, role play, and then interactive sessions, do it yourself things, making things. Next. And thus, the training was completed. After the trainings, these girls went into the community. In the community, they approached the families, they conducted a baseline survey, as well as motivated the mothers to form small groups. Next. Each girl identified, as I said, all the mothers in her locality, and these mothers groups were then formed. Next slide. Then what did they do with it? What was their activity? If we look at the activity of every single CCDA, they were working 4 days a week in the field, where every day they were conducting 2 mother-child group meetings. One with a group of 0 to 1-year-old children and their mothers, another one with 1 to 3-year-old children and their mothers. That way, 4 days a week, 2 meetings a day, each CCDA was conducting 8 group meetings. Next slide. And this continued for 22 weeks. So if you come to numbers, simultaneously 64 mother meets were being conducted and approximately 900 plus mothers were regular attendees. 1,408 such meetings had been conducted by the end of 22 weeks. And looking at it from the mother's perspective, every mother-child duo had 22 interactive sessions with the CC. Next slide. So we'll just show you pictures of some more activities that were done. Next. Can you see the pictures? Yeah. You can see the different activities. Yeah. Next. Let's quickly go through all these pictures to give you an idea. Next. Next. Again. And another. Okay, next. So, what were they doing? Next click, please. So they played together, they learned together, they created art, they made toys, they communicated, and most importantly, they had a lot of fun. Next slide. If we play this video, you can get a glimpse of the activity going on. Could we quickly go through maybe a minute through the video if it's possible? This is our trainer, the CECDA. Can you play the video? See, this is singing in action. Mother and children are all taking part. Okay. So we go on. Next, let's pass on from here. Along with it, a lot of innovative ECD tools were also created by us. You can see pictures of some of them, which includes reading material, an ECD guidebook, activity guides, picture books, teaching learning material, and so on. Next slide. And then the question comes, these 22 sessions, what were they doing? It was not just having a meeting and doing anything. It was a very structured program. Each day had a specific theme to address, and these 22 themes were based on the nurturing care framework, chosen carefully and in a graded manner. And each day's activity included discussion on that particular theme, sharing of views, demonstration of early stimulation methods, live participation by mothers and children, as well as various DIY activities. Next slide. Next, please. How things were progressing. Yes. Okay, so this shows us a glimpse from the activity book. We had created an activity book day-wise. Each colored sheet shows one theme and what are the things that are supposed to be done in a pictorial manner. This was being followed by the girls. Okay, so you can see day 7, day 8 is in the vernacular. You cannot read it, I understand, but you get a glimpse of how the girls were guided to work with the mothers. Next slide. So at this juncture, the point was, did this have any effect? So we wanted to find out what was the mother's response to the program. What had they learned? Next click. What was the family's response to the program? What had the mothers learned? What knowledge and skill had they gained? And what was the change in their attitude? And most importantly, was there any change noticed in the children? Next. Taking it all together. So we wanted to study the impact after 5 years. Next slide. So we conducted a randomized questionnaire with we chose 228 mothers in a random fashion out of those who were undergoing this program. Next slide. Next slide, please. So 200, no, the previous one. The previous one. Please go back. Please go back one more slide. Yes, here. It was okay. Okay. So 228 mothers were chosen. The unanimous statement that they made was they liked it and they wanted it to continue. Two mothers wanted an increase and altogether. Okay, so then we go on to with this attitude, what knowledge had they acquired? What have you learned is what we asked them. 40% mentioned importance of playing with the child. Some of them said that early learning through play is possible is something we did not know. This also we had learned. And 25% mentioned about positive parenting, proper child care, disciplining without harsh punishment, maintaining healthy home environment, were among the knowledge that we had acquired. Next, then coming to the skill part. Had they learned to do something? Yes. 62% were making toys at home now with locally available articles, which made it much more cost effective. 45% had started telling rhymes and singing with action, whereas 21% only were not only talking with the child, but also making, telling stories and so on. Some mentioned about drawing and using color. Next slide. So what about mother's perspective? Was there any change? Yes. Initially, it was about healthcare and nutrition, feeding the child, giving them shelter. That is all that they were concerned about till schooling started. But now a paradigm shift was being noted. Maximum number, more than 55% mentioned about promoting early learning and providing attentive, responsive parenting was what they were most concerned about. This was followed by nutrition, child safety, ensuring proper play, health and hygiene, and finally came in academics. So by 3 years, academics was not the priority as it was conceived earlier. Next, next slide. Coming to change of behavior. Okay, from what they had learned, was there any change in their behavior at home? Yes. 65% mentioned that they were spending more time with their children. More than half mentioned that they were now engaging with their child. That means they could make out the difference between just spending time and engaging properly, responsive parenting. 8 mothers mentioned about both parents, which is really important. Next, from this, we jump on to what the mothers thought about the changes in their children. Next slide. Next slide, please. So the previous one, before this, before this, the previous slide. So most of the mothers mentioned that the child had better socialization skills. They were playing with other kids, mixing with others. Their play had become meaningful. They were developing new skills, more active, following instructions. Communication skills were definitely better. Many of them had started to talk only after attending these programs. And moreover, finally, the child were happy and enjoying it. So, next slide. So with all this, the unique observation others had also made was that attachment to mobile phone had reduced. Some of the mothers and grandparents were replicating the nutritive supplements that we had taught them to make. And one mother commented about practicing parental emotion control to maintain peaceful home environment. This was unique, definitely. Next slide. So taking all this together, what we felt was that though initially the current population had minimum exposure to knowledge about child rearing practices, the common notion was that the child needed food, shelter, and healthcare. As he grows up, education will be necessary. But now, next slide, the conception of early learning opportunity, engaging and playing with child, responsive parenting were absolutely absent, which were inculcated. Next click. With the activity of a short period of 5 months, it had brought in significant change in the behavior of mothers, children, as well as other families. Next slide. But we do not think there is any place for complacence with this. This is just the beginning. We cannot afford to stop here. The stimulation has to continue. Next slide. Before I conclude, I would like to point out certain things that we need to ponder on. What is the retention of this endeavor that we had taken in a long term? What is the long term impact? What is the sustainability of these programs? And is upscaling possible? That's like these are questions that I would like to leave to this harvest gathering to take it home and think over it. Next slide, please. So this is the reason I wanted to share this small experience to understand whether there is any scope for replication worldwide. Next slide. Any suggestions for modifications from you all and any chances for networking? I would, any newer ideas, I would be very, very happy if any of you would come forward and think of any scope for collaboration and networking to take this further with a pledge to reach every child, every family in every corner of this globe. With this, I end. Thank you so much.